Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, physician on the Big Island and State Senator, Chair of the Health Committee. Today we have an extremely exciting show. We're going to be talking about healthcare transformation in our state of Hawaii. And we have the two best thinkers in healthcare reform at our table here in the state in Dr. Ginny Pressler and Beth Giesting. I'm going to do an introduction of both of these fine individuals here in a moment, but to have them at our table to talk about their new healthcare innovation plan, I'm going to show it to people right now, is really a luxury for us across the state. They're actually going to be on a so-called speaking tour. They're going to be with the governor, I believe, in the next couple days, and they're available to help people understand what our healthcare system needs are in our state. As we've discussed many times on this show, we have some healthcare challenges that are very difficult to overcome. We have physician shortages. We're doing everything we can to get more providers out there to take care of our people. We still have 7 to 10% of our population uninsured. Meanwhile, we're dealing with the mandates of the Affordable Care Act and trying to make our hospital system work for everybody. Jenny's been a leader from the hospital side and the Department of Health, Beth from the government and from the Primary Care Association. So first, let me introduce my two guests. Beth Giesting on my left, current Governor Healthcare Transformation Coordinator. I like to tease Beth and call her the health czar usually when I see her. She's not shy, and she will get in our face about healthcare reform when given the opportunity. She also is the State Health Information Coordinator, was the Executive Director at Kalihi-Palama Community Health Center, and was the CEO of the Hawaii Primary Care Association. So Beth's credentials are quite extraordinary.
Thank you.
Thanks for joining us, Beth. And then Dr. Ginny Pressler, Executive Vice President, Chief Strategic Officer of Hawaii Pacific Health, one of our biggest hospital, if not our biggest hospital system in the state.
Yes.
She's also a past Deputy Director of the Department of Health, co-chair of the Hawaii Healthcare Project. She's a surgeon. She comes with so many credentials that I really can't get them all on this short card. So,
thank you for your humility.
Yes, good to see you both. So thank you for joining me. I held up this healthcare innovation plan because I wanted people to see it, but you guys are really the people that have guided us to the point to be able to have a plan. You've convened innumerable meetings with all the other healthcare leaders across the state. So why don't we just dive right in, and Beth, if I could start with you, tell us what the healthcare innovation plan is about.
Okay. Well, as you talked in your introductory statements, there are lots of things going on with healthcare these days. And I think that in many respects, Hawaii has a really good system. We have many fine providers. We do have the Prepaid Healthcare Act, and so traditionally have a low uninsured rate. And yet we do have some persistent problems, and so it is important for us to recognize where we can make a difference in our healthcare system. And so we were very fortunate last year to have a federal grant that allowed us to convene people from all over the state, experts in many different fields, to develop a comprehensive view of how we can improve our healthcare system.
Tell me a little bit about the kinds of people that were at the table, because I think that people would be interested to know kind of the breadth of these individuals that came together.
Well, of course we had health insurers and hospitals who are major stakeholders in where the healthcare system is going. We also had physicians, nurses, we had community health centers, we had the area offices on aging and the county offices that carry these things out. We had the Department of Education, we had the university schools of medicine and nursing and social work. We had as broad a stakeholder group as we could.
Yeah, I think that's very important to impart to people who are watching today, that when I look at what you've done, which is really quite extraordinary, everybody was at the table. There was no one who wasn't invited to this panel. There were government agencies that insure lots of people. There was HSA, there was Kaiser, there was the hospitals, there were the docs when they could break free. I mean, to see that breadth of information go into a plan was very gratifying, because I think that when we look at the healthcare system, we all would agree it's more than just about the doctor sitting there with a patient. That, needless to say, for anyone who watches this program, we talk about a much broader healthcare system.
Yes.
What was your experience, Ginny?
Yeah, I think the beauty of this was this state health innovation plan really was a statewide consensus, and it was very delightful for me to sit around the table with all of the key stakeholders throughout the state, and it was so typical of Hawaii. It's probably one of the reasons why we continue to be the #1, the healthiest state in the nation by many parameters, and we get that every year and have for a number of years. And part of that, I think, is because we all collaborate and work together. We have an outstanding Department of Health. We have this terrific leadership now through the governor's office, who's been able to convene all of the stakeholders and really get people to work together to improve the health of everyone in the state.
Let me be a little provocative at this point. I agree with everything you said. We're the healthiest state. We hear that, and which is really, gratifying, especially as we remember our dear former Director of Health, Director Fuddy, who contributed so much to this process with her team. So we're the healthiest state. We get named the healthiest state. We kick the butt of Vermont and Minnesota and Massachusetts. Why do we need a healthcare innovation plan?
Well, unfortunately, even though we're the healthiest state, that's not saying much relative to the rest of the country. At the time when USA was saying, oh, Hawaii's the healthiest state again, and one of the reasons is, like other healthy states, they have a low rate of obesity. Well, guess what? Our obesity rate has doubled in the last 20 years. Now, that's not something that we should be very proud of. We're better than the rest of the nation, but that still points out that we have serious problems with trying to improve the health of everybody in the state. We've got a long ways to go. Plus, even though our overall statistics for the state are excellent, we have pockets where we have disparities, where not everybody enjoys the same level of health as the statewide statistics would suggest.
Yeah, and I'm so glad you bring that up, because I want to keep reiterating that. We've had people like Dr. Palafox and people from JABSM to talk to us about health disparities and the social determinants of health, which I do want to I hope to get into our conversation today. But those disparities are in many cases alarming. But on the other side of the coin, they give us an opportunity to have a target, right, for something to innovate on. When you look at our state, tell us what you celebrate as the things we do best, and then let's pivot to what we have big work ahead of us to do.
Well, I think that we have a lot to applaud with the Prepaid Healthcare Act, the fact that we do have one of the lowest uninsured rates in the nation. That has done a lot, I think, to provide good healthcare access. But insurance alone doesn't necessarily assure access. If someone has health insurance, but cannot get an appointment with their physician, or cannot even find a physician to take care of them, then they don't have access to care, even though they have health insurance. So we have to look at the whole access picture, and that's why one of the things I'm very proud of in Hawaii is our federally qualified community health centers, which help fill that gap, so that if someone does not have insurance, or even if they have insurance and can't find a provider, we have a system of community health centers throughout the state, as you know, that are probably better than anywhere else, any other place in the country.
They are very well distributed. They are very accessible in the communities where they need to be. So you're right. They also offer comprehensive services.
But beyond the access piece, we all need to work on providing care in a different manner, so that we're more focused on preventative care, engaging patients and their families in their care, having people take better care of themselves, so that we can continue to be the healthiest state, and really be the healthiest state in the world.
Right. Well, you might as well expand on that a little bit for us. I know Hawaii Pacific Health has been very innovative as far as preventive care and putting together a new model. Could you touch on that a little bit?
Yeah, what we've been doing at Hawaii Pacific Health has really been working very hard to engage patients and make access available to them. We've expanded our hours. We've made it available for patients to get same-day appointments. When they have something that needs to be taken care of today, they shouldn't have to wait for a month to be taken care of. The problem's gone, right? Or they end up in the emergency room. So we're trying to change the delivery system so that it's easier for patients to get care when they need it, with whom they need. They can do it online. They can do it. They can contact either their physician or someone on their physician's team. And all of the changes that we're making are to make it more accessible and easier for patients to be actively engaged and understand the things that they need to do to improve their health.
So it seems to me likely that that kind of action in your experience has informed some of your work here. Is that what people would see when they open up the innovative plan?
Yeah, much of it is similar to, these are best practices that we know throughout the country, and we're certainly embracing all of these at Hawaii Pacific Health.
Yes, it's excellent. Now, Beth, Ginny mentioned also the community health centers at length. Why don't you, while we've got you here, because you were the Primary Care Association director, tell us what the health centers contributed to the plan and how they might be incorporated into this transformation plan.
Well, I think that information that they brought to this was really key, because health centers have a different way of practicing. They are very focused on primary care, but they integrate behavioral health services into primary care, which is one of the practices we'd like to see very widespread across our system. They also provide very patient-centered care.
Yes.
They tend to see people who have complex socioeconomic issues as well as healthcare issues, so they may need somebody who is an interpreter. They do outreach to the homeless. They're taking care of patients who really need a lot of extraordinary care, and so those are the things that they bring together. In addition to that, they recognize that their patients are not going to get care elsewhere, so they provide dental services, more extensive behavioral health care, WIC nutrition services. They do the whole gamut, and they also focus on wellness.
Yeah, it's so important to have their input into a process like this, because they in many ways have been a large chunk of our healthcare safety net, both historically and we can imagine going forward. Since I've got you two experts here with me today, Affordable Care Act, a lot of people will say, excellent that we're going to get everyone insurance. Who's going to care for these individuals? What's your response to that?
Yeah. Well, we have a shortage of physicians already in the state and across the country, particularly in certain areas. One of the things that we have to do is be a lot more creative about making the best use of all healthcare givers to the maximum of their license. And so part of this plan and part of what we're doing at our hospitals, Kapi'olani, Pali Momi, Straub, and Wilcox, and Hawaii Pacific Health, is expanding the workforce so that we're making better use of nurse practitioners, physician's assistants, but also as we develop these community care networks approach so that we have outreach workers, social workers, care managers, patient educators, coaches on how to lead a healthier life. All of these individuals need to be part of the healthcare team so that we can really provide access to care to patients when they need it.
And I think that harkens back to the comments that we started with, which was healthcare is not just your doctor sitting across from the patient or your nurse practitioner sitting across from the patient even. It's that multitude of health professionals that have to somehow bring the patient to a healthy place from a prevention standpoint, from a proper disease of their chronic illness standpoint, from a detection of their behavioral health challenge or their mental illness that often goes undiagnosed before it's too late. So all of those things, and I see that right off the top on page 3, it's primary care practice redesign, getting people into the patient-centered medical home, which we've had specific shows designated to the PCMH, the patient-centered medical home, but it's gratifying for me to see that your work ended up expressing it here right at the kind of the top of one of your provisos. Tell me, how will that happen? How will we get to a statewide view that we have to do PCMH?
Well, we already have this initiative well underway, and in fact it started before we even pulled our stakeholders together. The insurers and the Area Health Education Center and the School of Medicine, I think, had already gotten on this bandwagon and were helping to help providers be patient-centered medical homes, which really are talking about a teamwork delivery system, focusing on primary care, prevention, more accessible hours, keeping track of all of the records. If your primary care provider sends you to a specialist, you manage that referral and get the information back. And so those were initiatives that were already underway. And I'm very pleased to say that all of the insurers in Hawaii agreed to the basic definition of what a patient-centered medical home is and their approach to payment. And that really is extraordinary, and I think speaks to the stakeholder willingness and collaboration here in Hawaii.
I think that was one of the victories about what you did, and that was by having all these people at the table, which we can actually do in a small state like ours, repeatedly, over and over, getting them there, hearing this again and again. I think they took it seriously, and to have people actually pay for the services, as you were describing it, Ginny, this multitude of healthcare providers, which they don't work for free. They're good professionals. They need to be paid as part of the healthcare system in a good return on investment in the healthcare concept way. But if we didn't have HMSA or Kaiser or UHA and so on to pay for these services, It's hard to ask people to do it.
And the good thing is, this isn't just concepts. We have good data now showing that we've actually improved quality outcomes for our patients with this model of care, because there's more of a focus on patients being engaged, knowing what their lab results show, being coached on how they can improve them, and being accountable, because they see that stuff and they can track their blood pressure over time and their weight online on their record. And so it gives them immediate gratification, if you will, because they're seeing the results of their efforts to improve their health care.
Yeah, well, to be able to empower people in a way to take care of their own health, I think is going to be central. Yeah. We're going to take our first break here. I'm Josh Green with Healthcare in Hawaii, joined by two of the healthcare experts in our state, Beth Giesting and Jenny Pressler. Thanks for joining us.
Castle and COOKE Hawaii, investing in Hawaii, creating communities, and providing for the needs of our state. Collateral Analytics, empowering the real estate industry to make better informed property investment decisions. The Foreign Trade Zone, bringing the benefits of the Foreign Trade Zone programs to Hawaii businesses and entrepreneurs. GALEN Ho, a senior executive of BAE Systems, a global defense, security, and aerospace company. Hawaiian Electric Company, and its affiliates Maui Electric and Hawaii Electric Light Company on Hawaii Island. The Hawaii Energy Policy Forum, incorporating diverse perspectives to design a flexible and forward-looking energy strategy. Hawaii Energy, the state's energy and efficiency program created to help Hawaii's residents and businesses adopt a clean energy lifestyle. Hawaii Gas, helping Hawaii achieve its transition to clean energy and a better energy future. Hawaii Pacific Health, bringing technology and teamwork together to transform healthcare in Hawaii. The High Tech Development Corporation, attached to DBED, is the state's leading technology agency. The SHIDLER Family Foundation, supporting educational, cultural, and charitable organizations, including ThinkTech.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, ER doc from the Big Island, and here working on health policy at the Senate. Today I'm joined by Dr. Jenny Pressler and Beth Giesting, two of our healthcare leaders who have been working on this plan. Let me hold it up for you again, the Healthcare Innovation Plan for the state of Hawaii. In our first 15 minutes, we had an excellent discussion about some of the challenges, and Ginny and Beth were able to mention health disparities, our obesity rate, access to care, and the scope of the community health centers and the many providers in our system that are going to deliver the health care to our people as a part of a team. And though we're the best state as far as healthcare ranking, you could say, we still have many challenges ahead, as all of you know, to find a doctor, to make sure the healthcare system is better, not just in any other state, but competitive across the world. We talked about this primary care practice redesign in the patient-centered medical home initially, but now I'd like to turn our attention to the second bullet point in your proposal and plan, care coordination, because I know it's so central to what you believe must happen in the state to make things better.
Yes, it certainly is. Whereas we believe everybody ought to have their patient-centered medical home, we know that there are a number of people who also have such complex health and or social issues that they're dealing with that they need other kinds of help to get the kinds of services and support that they need to be well. So we are contemplating developing a community care network which would fill in the gaps for those patients who have other kinds of case management, care coordination, people who have complex chronic diseases, for instance, who take a lot of different medications, who go to a lot of different specialists, who get a lot of different tests. Basically, their lives revolve around going to the doctor, and right now they're kind of left to their own devices to figure out how it all fits together. And that really is not going to work very well for somebody who's not a medical professional. Right. So a care coordinator can help manage their care, make sure that they're not overdosing, taking too many or the wrong kinds of medications, can help them in their home to make sure that their home is not full of tripping dangers, all kinds of things. But then there are also people who have other kinds of social issues, the homeless population, people with serious mental illnesses. This would be for the relatively small number of people who need extraordinary personal attention.
I would be remiss also if I didn't mention that in the state, we have our budget for the Medicaid population for our citizens. It's about $2 billion. And in the course of my work with the Hawaii IPA and with the help of Aloha Care, actually, they helped us do an analysis of our patients. And we found that it was 3.6% of our patients across a big sample consumed 61% of the healthcare dollars for that block of money. So if you begin to extrapolate that, and the numbers are pretty consistent across all the plans, you see that of the 300 or so thousand individuals on Medicaid, a small percent, 5%, somewhere around there, are consuming well over half, which means that you have an incredible opportunity, and we have a need to commit to our people in the state to take care of those, say, 15,000 some odd people. It's about $1 billion worth of resources. And that's why I think when people are watching and listening to us talk about this, it's so important to talk about coordination. It's not about a wasteful service, God forbid. It's actually about getting better care to those individuals that right now, for example, I have a patient when I'm up on Big Island. He comes to the ER somewhere between 100 and 150 times a year. In an ambulance. And I would say in the last 5 years, he's probably only needed that ambulance twice, but he's used it a couple hundred times. Very expensive. He has challenges, this gentleman, but it's so expensive when we could provide so much more quality care for him. He gets nothing from that ambulance ride per se, except for the lift to the hospital. There's so much additional resource that Ginny at one of her hospitals could be providing, or with one of her providers. So we need to care coordinate this individual and help him, in this case, men and women both, work toward a much better healthcare experience. Are you seeing that?
Yes, and I think we need to recognize that when we talk about a patient-centered medical home, it's not one size fits all. Right. And because we have electronic records throughout our system at our hospitals, Kapi'olani, Pali Momi, Straub, and Wilcox, we've been able to collect the data on individuals so that we can identify, just as you have been given that information, to know which patients need what kind of care. And many patients who are otherwise healthy, they just need to be reminded, and then we need to follow up to make sure they actually come in for their screenings and their routine care. Other patients who might have high blood pressure or diabetes, they need to be monitored and managed, and we have registries. We get the information to the physicians. They know when a patient needs follow-up, and that doc has to do it, but that there's a team of people out there, a SWAT team out there, making sure these patients get in and get taken care of. And then they're the more complicated patients who have multiple issues, and that's where these community care networks come in, where we need to have people for the transportation and the communication and the outreach, so that they don't have to take the ambulance to go to the emergency room every time they have a problem. You got somebody managing them where they live, wherever it might be, whether it be on the beach or whether it be in a nice home somewhere. Those patients need to be managed very tightly so that they can be kept healthy and out of the emergency room in the hospital. That's better quality of life for them.
Well, to give you an example, I took a patient home once afterwards because they didn't want to take the ambulance back. So I was at countryside medicine, so I drove him home. And this guy, the reason he's taking the ambulance all the time is because he's got a tree that's uprooted and growing through part of his car, the bottom floor of his car. And I mean, he's going to need some real help. And he doesn't just need a mechanic or a hedge trimmer. He needs somebody telling him, you got to go to the hospital, you got to go to the doctor, you need these kind of services.
That points out a very critical aspect of all of this, that it isn't just the traditional health care that we're talking about anymore, it's the social services.
Yes.
We're working together with the city and county on the homeless so that we can get a roof over the head of some of these patients that are constantly coming into our emergency room because they don't have a place to sleep. And so they need a house, they need a place to be, and we know that their health outcomes will be better if they have a roof over their head and a safe place to be.
Right, and it goes without saying that some of those individuals have children, and the children aren't getting their immunizations perhaps, or they're undernourished, and their ability to do well in school is just not going to be there, and they're going to have health problems, and they're going to have these so-called health disparities very quickly that we mentioned, and I think we'll come in a more robust way as we go into our next segment. You picked these several different groups. There was the group A that just needs a little reminder, and then there was the next group that had some health problems, and then they're really seriously challenged individuals. Where do you think we're going to start?
Well, certainly if we're going to make a major improvement in the outcomes for patients. We can move. We've shown that we can improve blood pressure and diabetes management on large populations of the otherwise relatively healthy and engaged patients. So
Right.
it's not just starting at one place. I think it's a multi-pronged approach, and knowing that you're going to take different approaches with each of these populations of patients. So it doesn't take too many resources to take care of the broad base of patients that don't need a whole lot of help. And then it's going to take a little bit more for those who need some chronic disease management. And then we're really going to need to bring in the social services and the social workers and the mental health and the other pieces to really manage that other population. But I don't think it's just going after one segment. I think we need to do the whole pyramid.
Yeah, it's interesting. I think that's a very good natural segue to payment reform, which is the next bullet point on the plan in the healthcare transformation vision. We've already discussed a little bit of the payment reform that's ongoing with patient-centered medical home. A pretty significant amount of additional resources going to those primary care providers that are doing a decent job with patient-centered medical home. I know, I've seen it. I've seen people get pretty significant added resources for their practices to reinvest and provide that screening, provide the awareness and the reminders and so on for that piece of the population. But then now we've got to go into that next big phase, right? These individuals that are consuming some part of I think in Hawaii it's about $9 billion that comes through the healthcare system per year, but the Medicaid budget and the Medicare budget, where people have bigger illness and bigger challenges. Yes. How are we going to get there? When I read payment reform and it says transitioning all payers to value-based purchasing, how do you get there? That seems like a big lift.
It is a big lift, and it again takes a lot of different strands to get there. But what we're trying to get at is changing the way we pay for healthcare so that it supports the kinds of practices that we've been talking about: patient-centered care, care coordination, and improving the wellness of individuals. So much of the problem of our healthcare system in the past has been that we paid for office visits, we paid for procedures, we paid for all these expensive things, and so we incentivized all the wrong things. What we need to be doing, and as has already started with patient-centered medical homes, is identifying some of the basic high-quality services that need to be delivered and ensuring that there's a payment that is associated with that. But I think as we go on down this continuum, we will pay for keeping patients well. It is conceivable that a healthcare system or a doctor will be paid for keeping patients so well that they don't ever need to go see the doctor.
Yeah.
So wouldn't that be great?
Another example is the patient health home that's in the bill that's in the legislature right now. Yes. For Medicaid to provide this 9-to-1 federal match for the federally qualified community health centers to provide this wraparound comprehensive care. They already do a lot of that, but this would give additional resources. And the reason there's a 9-to-1 federal match is because these patients aren't going to just cost a few extra dollars to take care of them. We're talking about a 20-fold increased cost in order to really manage these patients and keep them out of trouble.
Yeah, I think that's important to point out that the average patient out there, citizens, may consume a couple $100s per month of health care. They're basically healthy, they're walking around, they're working, whatever. But then there are some individuals that are consuming $2,000, $3,000, $5,000 a month or even more, not just when they have a heart attack, and we all need health insurance coverage, it's the point, right, to help us through the most difficult times in life, but also routinely using very large amounts of resource that could be much better used for prevention, like you said, and for a whole raft of services in the community. Because when you say social services, I think the legislature has had this impact. I mean, I think, okay, we're going to have to fight for that budget item somehow or other, and sometimes it's not sexy, but it's so necessary, and it has a good, it has a really good, it's such a great human investment to imagine people not ending up in the hospital, to imagine them not getting to a place in their lives where a basic healthcare problem turned into some catastrophic issue.
Well, and a lot of the services that we are talking about linking a person to are services that already exist. So if you're trying to get them to make sure that they're better fed, you get them in the WIC program or get them food stamps. You can help get them into subsidized housing, work programs. There are a number of different both public services and nonprofit services that we would be able to link them to.
And for my neocon friends out there, and I have many of them, these are good investments in people, because when we invest in people in these ways, to get them services, to get them nutrition, to get them homes, they don't end up costing both themselves a lot of suffering and the state many, many tens or hundreds of thousands of dollars through crisis. So I think that's a good place for us to take our next break. And when we come back, we're going to start talking about some of the tools that you're recommending, health information technology, tools to get our workforce development in place, and so on.
Yes.
So again, this is Josh Green with Healthcare in Hawaii. I'm so glad you joined us. We're having a vibrant discussion with Dr. Ginny Pressler and Beth Giesting.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator and Health Chairman for this year at the Capitol. I'm joined today by Beth Giesting, who is the Health Czar for the Governor, who works on all things healthcare transformation in our state, and she produced with Dr. Ginny Pressler, who's also joining us today, the Healthcare Innovation Plan for our state of Hawaii. It's a really visionary plan which addresses so many of our healthcare challenges in our state. We've often been described as the healthiest state in the country, but sometimes that's just not enough. We still have incredible challenges, especially if you're an individual out there unable to find a doctor, too far from a hospital to get the services you need, or have a crisis that just can't be managed. So today we're talking about solutions along all of these veins. We've talked about primary healthcare redesign to make our system economically functional. We've talked about care coordination to make our system work better for those who have some of the greatest needs in our society, often a lot of chronic and severe illness. We talked a little bit about payment reform, patient-centered medical home, and beginning to look at new innovative models to even keep people healthy, as Beth pointed out. But now I wanted to touch on a couple technical issues. And first I'd go over to Ginny and say, health information technology. You know, I've heard you talk a lot about that. I know that HPH is doing extraordinary things with health IT. Tell us why we have to do it.
Well, health IT is multi-pronged. You've got patient information that not only patients can have access to their information with their families, but their primary care and their specialists can all communicate with each other, and it's all there, available 24/7, all of the time. The other piece is being able to use that information to do analysis to figure out where can we make a difference to improve health outcomes, not only for an individual patient, but for populations of patients. It's very, very valuable to get all that data collected. And lastly, for the health, things like telehealth, especially in Hawaii with an island state, we have such an opportunity to provide better care and access to individuals and to primary care from specialists from Honolulu through the use of telehealth. And we're just beginning to be able to touch that. And there's so much opportunity there if we can really use telehealth to its full advantage. Mental health, dermatology, even stroke care, things like that are all being done by the use of a specialist at one end, primary care, or an emergency room physician, or even a family member or a patient at the other end.
And it's funny that you mentioned that, because I want to dig into the HHIE in a second, but a little vignette. I used to have a dear friend who passed this past year, Dr. Tyson, a wonderful infectious disease doc and a character in his own right. And when I'm on call on the weekends, I would often take a picture of a significant infection, and I would basically texted over to Dr. Tyson. He gave me an opinion. And sometimes it was, always it was extraordinarily helpful. It was not done the way we should be doing things. It wasn't a part of a grander system, but we saved many, many patients trips over to Oahu. He was able to guide me and give me advice as a consultant, consultant specialist in ways I couldn't access from far away. And I think as these systems mature and become legitimized, we're going to be able to provide so much care. So I really wanted to kind of honor Dr. Tice and his commitment to healthcare in his passing this year, but also that is what's really going on, but we have to do it better. Tell me, how can we do it better? What's the story with the Hawaii Health Information Exchange? We had Christine Sakuda on a couple months back. She's terrific. What are we going to have to do to create this, and what is it? Why don't you give us a kind of the little snapshot of what the HHIE is?
Well, Beth may want to add to this, but to my understanding, the Hawaii Health Information Exchange is exactly that. It's an exchange of information. Right now, it's not necessarily a repository of information that's kept at the various health providers' sites, but it exchanges information so that if a patient is admitted to an emergency room in Hilo, they can access their records from Straub, or from Queens, or from Kapi'olani, or wherever. And that information is available when it's needed. So it acts like a telephone connection, but it's electronic sending of health information under a secured private.
Right, and that was the rub. That's why I tell that story about just taking a picture, because that wasn't the way it was done. I always ask the patient, can I share this with a friend? And they were like, if it gets me better care, you bet. Which I think is interesting, because though we often worry about privacy a lot, and we should, patients want good care. They want to get better. Is really their first and foremost thought. But some of these questions are very private, whether you have a cancer or an HIV infection or God knows what, you want your privacy maintained, which brings me to you, Beth, because you're, as I described, the State Health Information Coordinator, right?
Yes.
So another title, another responsibility. What do we need to do, in your estimation, to have a system like what Dr. Pressler described? Ginny said, we want to be able to be in Hilo and have this test or this visit, but be able to convey it perhaps to some provider over at Straub or Queens or goodness knows where.
Well, a lot of this is about developing the infrastructure, and the infrastructure includes getting all providers to use electronic health records competently, and that movement has taken hold with physicians pretty largely, although there still are some that we need to get on board with that.
Right.
But as we change our healthcare model, we need to make sure that long-term care and care coordinators and everybody who touches the patient in some way has access to accurate information. And so that requires a very different way to develop the infrastructure for sharing and security and data governance and business agreements so that information can be shared. But I truly believe that health information technology is a tool that is going to mean a lot to us as we move forward. Because, we all know how smartphones have revolutionized our lives. I think that the generation coming up now are not going to be tolerating a healthcare system the way it is right now. They are going to be much more proactive and use the tools they have at hand.
Absolutely. In fact, I know that the new grads from JAPSOM and from across the country, when they come, they expect to have a device, whether it's an iPad or a tablet computer or a decent EMR system, as a part of their practice. There's no question about it. I don't mean to joke here, but honest to goodness, my 3-year-old knows how to turn on my iPad and navigate icons, go into programs, come out of programs. He is 3 years old, and I fancy him as the proud father, a very smart little guy, this Sam, but he can do it. Technology has changed the way the next generation deals with things, and certainly in the healthcare industry, I have every expectation that it's going to be tying right into many of the visions that you have in the healthcare transformation
And the
plan.
other thing that I would like to mention is its importance in home health, which is just beginning to be recognized, so that you can do home monitoring and really keep an eye on people who are in a kind of a fragile state, but help them avoid going to the doctor or the emergency room or the hospital by monitoring their health status and taking care of it in a timely way.
Yeah, I would predict that in this next 5-year mini cycle, that's going to be one of the biggest, if not the biggest change, that people are going to have a device, a simple device, whether it's a watch or bracelet or what have you, that will also be able to connect into individual physician and healthcare providers' medical record systems and the HHIE, so that we start capturing a lot of data that is secure, that can help people get better access to care and better use of their time. So you're not dragging yourself into the emergency room. If you have a concern, you can actually say, what's your blood pressure to the individual at home. You can ask them what their heart rate is if they've had a heart condition like atrial fibrillation. You can say, no, you're okay today. Always, we're happy to see you, but we can tell you with some certainty that maybe just a home visit from the nurse, which may cost $150 rather than a hospital experience, which could cost $3,000, is the right thing to do. And I know we've talked a fair amount about money today, and I only focus on the money in healthcare because one way or another it's going to translate into what we can give people for their health. And it's not lost on me that many of the points that you brought up in the program do touch on resources.
And I think that the important thing to note is that we can spend money and have a better healthcare system that is actually going to cost less.
Yeah, that'll be amazing. And that's borne out in reality, because when we had the deep recession not long ago, we went from spending somewhere around $3.1 trillion as a nation to closer to about $2.7 trillion for a brief period. And to have an actual decline, which is shocking to many people in health economics, right, 3 of us included, was an important point to take away from that recession, which it's exposed a capacity for us to spend less on healthcare. Complicated question. I know people decided not to do certain things. They put some care off. But we do have a system that has some give, and we certainly have a system that can be more efficient. I personally think that we have room to find 30% in savings. How we spend that money, we may need to spend it because we have a booming senior population coming. We seem to have this obesity challenge, which is causing incredible amounts of diabetes. $300 billion, I think now we're spending. So we may spend that money anyway, but we certainly aren't going to have those resources if we don't do something smart.
Yes.
You also talked about workforce development. When you talk about that in the context of the healthcare transformation plan, what do you mean?
Well, what I mean is that we're talking about changing the way healthcare is delivered so that we have a team, the right person taking care of the patient at the right time in the right setting. And that really requires us to rethink the kinds of people who are providing the healthcare. And the healthcare professions are just as siloed and fragmented as every other part of healthcare right now, and we need to make sure that the workforce is all being trained together to practice in teams, that we are inventing new health professions to take care of the needs that we see in the future to be parts of the teams.
And that's a very exciting piece, because not only are we identifying new kinds of roles that we need in the healthcare provider network,
Yes.
But this creates opportunities for our youth in Hawaii for new job opportunities. Many of them are at the community college level, don't necessarily require a 4-year degree, so that we're expanding opportunities for the people in Hawaii for new careers, as well as improving our workforce that's much more creative, much more cost effective, so that we can provide for what patients need, even though we have a shortage of physicians.
No, I think you're totally right. I'm so glad you mentioned that, because on a couple occasions over the last year, I've talked about people should consider healthcare as a career, because
It's a great career.
It's a great career. It's explosive in many ways, because from the looks of this, there's so many new opportunities that are going to be coming, and there's no question at all. We've touched on telehealth, traditional disciplines like being a physician or a nurse or a social worker or a pharmacist, to being a care coordinator or a technology expert, but you have a focus on healthcare. And if I'm not mistaken, you two have been some of the individuals, or amongst the leadership of the individuals, that have been promoting a kind of more like an institute where we train people more together. Am I not?
Yes, we
correct?
are very supportive of that, and the University of Hawaii is talking about pulling that together and creating those training opportunities with the community colleges as well. So that's very exciting.
Crossing over disciplines so that we're really working together and not in these silos.
Right, and we're seeing that before we go to our third and final break. We're seeing that in Hilo, where they're talking about a joint degree between
Yes.
nursing and pharmacy. I know that the medical school is interested in adding public health in its midst, and we have the Cancer Research Center right there, and there's a lot of cross-pollination of ideas and programs. And then, of course, what you mentioned, probably most important, is that the community college level, where people can really lift themselves up economically by getting that extra degree and have an extraordinarily good job where there's a lot of resource but an incredible amount of need. These are things that I think shouldn't be lost on people that are watching our show today. So we're going to take our third and final break. I'm Josh Green, host of Healthcare in Hawaii, here joined today by Beth Giesting and Ginny Pressler. We'll be back with you in a minute.
Aloha, I'm Maria Kashem of ThinkTech Hawaii, and I want to tell you about our ThinkTech talk shows. If you didn't know it, ThinkTech streams video and audio for all of its shows live on the internet from 2 to 5 p.m. every weekday afternoon, and we replay them all night long on ustream.tv. Visit thinktechhawaii.com for our live stream and YouTube links. Raise your awareness on ThinkTech. I'm Maria Kashem, and I'll see you there.
Aloha, I'm Jay Fidel of ThinkTech. We have some news for you. In addition to our ThinkTech TV show and our Asia in Review show on Olelo 54, as of January 1st, we're adding Community Matters to play also 2 hours a week. Check out thinktechhawaii.com for the specific times of each of these shows. We hope you enjoy all three. Mahalo, I'm Jay Fidel.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island and ER Doc. Today I'm joined by Beth Giesting and Ginny Pressler, two of our best minds in healthcare reform for the state. We only have a few minutes left today, so we've spoken at length and really in great depth about the healthcare transformation vision for the state of Hawaii, which is part of the governor's package, and these have been our two leaders on the program. We've talked about our healthcare shortage and challenges. We've talked about care coordination and payment reform and how to make this system better than ever. Even though we're the healthiest state in the country, there's lots of things we have to work on, like health disparities. All of these things have been discussed, but now I turn to Beth and I say, what do you need to get this done? What kind of infrastructure do you have to have?
Well, I think that in the state government, we have the same kinds of silos and fragmentation that we have all across healthcare. And so in order to create the infrastructure to continuously build toward a better and evolving healthcare system, we need to look at how we create the structure. So aligning the considerable amount of money that we have that's devoted to healthcare, and I'm looking particularly at the $2 billion that we have for the Medicaid program, the considerable dollars that go into supporting the public employee and retiree system, and the health policy, which is often at the Department of Health, and insurance regulation at the Department of Commerce and Consumer Affairs. We all have good intentions, but we're not working from the same playbook. And so that's what we need to do next, is create the alignment of state policy, program, and vision for meeting our priorities.
So a true health planning authority, a
Yes.
true one that's embedded either with the governor or through the top, from the top on down, like you guys have produced with this, the transformation vision, something that can guide us so that we don't have to worry about loss of resources, waste, or just placing resources in important places, but not the most important places.
Yes.
And then I turn to you, Ginny.
Yes, and all of that, and we need to continue the statewide planning so that we make smart use of limited resources. So we don't want all of this innovation that's come forth from all of this collaboration with all these stakeholders to just, it's not static. It's a continually moving effort, and so we need to put the infrastructure in place to allow the continued convening and make sure that we're all working together. Department of Education, Department of Health, the Insurance Commissioner, all of the healthcare providers, the social workers, the pharmacists. I mean, requires everybody to be connected, and we can do that because communication is so much easier when you have electronic connectivity and shared information.
Yes. Well, I really am so glad that you guys were available today to speak about healthcare transformation. I think if there's one message, that's that a plan like this could happen in very few places, and this is something worth looking at, reading if you're a healthcare professional or you're just interested in the health of your state. We look forward to further discussions with these two individuals and all the people across the healthcare spectrum in our state, because there's just simply too much on the line not to make this work. So thank you for joining me. I'm honored to have been your host on Healthcare in Hawaii. We'll see you again soon.